How do patients recover from testicular cancer, RPLND? Recovering from a retroperitoneal lymph node dissection for testicular cancer involves several important steps that help patients regain their strength and health. After the surgery, most men stay in the hospital for about a week to 10 days. During this time, the medical team closely watches vital signs, manages pain, and checks for any signs of complications like infection or bleeding. Early on, patients are encouraged to start moving around the day after surgery to prevent blood clots and improve lung function. Using devices like compression stockings can also help prevent clots in the legs. Pain is usually controlled with medications, starting with stronger painkillers but gradually reducing to over-the-counter options like acetaminophen. Managing bowel movements is important, so stool softeners are often recommended to prevent constipation, which is common after abdominal surgery. Side effects can include pain, fatigue, and temporary changes in bowel or bladder function. Some men might experience retrograde ejaculation, where semen enters the bladder instead of exiting during orgasm. This can affect fertility, so discussing reproductive plans with your healthcare team before surgery is essential. Although rare, complications like infection, bleeding, or injury to nearby organs can happen, but careful surgical techniques help reduce these risks. Patients should watch for signs of infection, such as fever or redness at the incision site, and report any concerns promptly. Once discharged, recovery continues at home. Most men need about 1 to 2 weeks of pain medication, after which over-the-counter options are usually enough. It's important to gradually increase activity levels but avoid heavy lifting or strenuous exercise for several weeks to allow internal tissues and muscles to heal properly. Follow-up care is a key part of recovery, with regular scans and checkups typically scheduled every 3 to 4 months during the first few years. These visits help monitor for any signs of cancer returning and address ongoing side effects or concerns. Many men who have successful surgery and no signs of recurrence can return to their normal routines and enjoy a good quality of life. The chance of cancer coming back drops significantly after 2 years, especially in early-stage cases. However, individual outcomes depend on factors like the cancer's stage, lymph node involvement, and overall health. For those concerned about fertility, sperm banking before surgery is an option worth discussing with your doctor. Open communication about reproductive goals is very important, and specialists in male reproductive health can provide guidance if needed. While this information focuses on testicular cancer, it's useful to remember that treatments for other reproductive cancers like cervical cancer involve their own recovery processes. Each type of cancer requires a tailored approach, but the principles of careful monitoring, managing side effects, and supporting overall well-being are common across treatments. Always follow your healthcare provider's advice, as recovery experiences can vary from person to person. If you have questions or worries about your recovery, reach out to your medical team for personalized guidance. This information is based on current medical guidelines and research, and it's meant to help you understand what to expect during your recovery journey.